Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Aqilah Binti Ahmed Saifuzzaman and my partner Adilah Binti Ayub. So we are going to present about modalities in medical imaging. First, I'm going to start with CT scan. CT scan was created by British engineer Godfrey Hounsfield of EMI Laboratories in 1972, and he co-invented the technology with physicist Dr. Alan Cormack. The application of CT scan is to take a serial series of images of slices of the body and then put them back together with a computer to visualize internal structures of the body. CT scan can cost about $65,000 to $2.5 million. Next, we have MRI. Raymond Damadian, a physician in 1969, he first proposed the idea of using nuclear magnetic resonance technology to scan the human body externally for early signs of malignancy. Performed the first full body scan of human being in 1977. The application of MRI. MRI is best when the image needs to be very detailed, looking for cancer, causes of dementia, and neurological disease, or looking at places where bone might interfere. MRI can be cost about $150,000 to $1.2 million. Mammogram. The history of mammogram. In the late 1950s, Robert Egan at the University of Texas MD Anderson Cancer Center combined a technique of low kVp with high MA and single emulsion film to devise a method of screening mammography for the first time. The application of mammogram used as a screening tool to detect early breast cancer in women experiencing no symptoms. They can also be used to detect and diagnose breast disease in women experiencing symptoms such as a lump, pain, skin dimpling, or nipple discharge. Mammogram can be cost between $200,000 to $500,000.
Hi, I am Adilah Binti Ayub. So now I will continue the presentation. The next modality that I use in medical imaging is X-ray machine. X-ray machine was invented by Wilhelm Conrad Röntgen in 1895 after 7 weeks of hard work in which he had studied the properties of this new type of radiation that can pass through screens of notable thickness. And he named X-rays to underline the fact that their nature was unknown. The most familiar application of X-rays is checking for fractures or broken bones. The examples might include the observation of the broken bones and torn ligaments of football players, and detection of breast cancer in women, or the discovery of cavities and impacted wisdom teeth. And the cost for X-ray machine is about $125,000 to $235,000. Next, fluoroscopy. It was discovered by Thomas Alva Edison in 1896, which is 1 year after Wilhelm Conrad Röntgen's discovery of X-rays. He began investigating materials for the ability to fluoresce when X-rayed, and by the turn of the century, he had invented a fluoroscope with sufficient image intensity to be commercialized. Edison also had quickly discovered that calcium tungstate screens produce brighter images. The primary function of the fluoroscope is to create images of the internal structures and fluids in the human body. A fluoroscope allows a physician to see the internal structure and function of a patient so that the pumping action of the heart or the motion of swallowing, for example, can be watched. Next, the cost for fluoroscopy is around 16,391 to $45,844. The last one is PET scan, and PET stands for positron emission tomography. In 1974, PET scans was discovered by Edward J. Hoffman, which is UCLA professor of nuclear medicine. Together with Edward, Michael E. Phelps also invented PET scanner. The cost for PET scan is around $1.7 million to $2.5 million, and for the application, PET scan uses radiation to show activity within the body on a cellular level. It is most commonly used in cancer treatment, neurology, and cardiology. It shows not only what an organ looks like, but how it is functioning. And it used to diagnose certain health conditions, to plan treatment, to find out how an existing condition is developing, and to see how effective a treatment is.